it's important to bring attention to obviously men's health, has various realms to it. It could be, general overall well-being, mental well-being, in terms of cardiovascular, diabetes, hypertension. And then, the major other aspect is, focusing on cancers, because as men tend to age, there is always a risk of cancer in general, based on risk or no risk. It's important to pay attention and also to understand what's out there. How can we identify cancers early? How could we prevent them early? So with that idea, I have, tailored my current talk in a way that it focuses on the most common cancer, and I'll, walk you through the process. So the first slide, so who is a genitourinary oncologist? Obviously the big, sometimes the word itself is a tongue twister, genitourinary. We focus on cancers which are arising from either kidney, the drainage tubes which come out of the kidneys, something called ureters, bladder, prostate cancer, and penile and testicular cancers. So obviously, in men, we focus on the prostate and testicular, whereas kidney, ureter, and bladder are common in men and women. So we see those cancers as well. Now, obviously, in women, the genitalia are, obviously different. We talk about uterine cancer, ovarian cancer, cervical cancer. Those group of cancers are generally evaluated and managed by gynecological oncologists. So it's important to understand all the realms, because we as cancer physicians subspecialize, very focused on these specific cancers, so that we help with the latest and the greatest information in those cancers, and also provide the best treatment strategies. So this is the genitourinary system, and my focus, to get into a deep dive on these cancers, let's start talking about first prostate cancer. Before we do a deep dive into it, let's talk about what are the things I'm going to talk in this section. So first of all, where exactly is the prostate gland? What is it? And what can go wrong with prostate? I think these are the various common things, for men who are, in general, more than 50. We keep bringing up the conversation. You may be seeing ads on TV, or read some magazines, or any literature which talks about men's health, eventually percolates on prostate health. And we'll also look for if something goes wrong, what are the symptoms? What are the signs? And then focus on who is at risk for prostate cancer and what can you do to prevent prostate cancer. So the most common question I like to start, in general, when I'm talking to general public about prostate cancer is, where exactly is prostate gland? There has been a survey sent out in United Kingdom, and it was surprising that 2 out of 3 adults didn't know where the prostate was. When the questionnaire was sent out, whether it is in the chest or mid-torso or underneath the bladder, folks were confused. They didn't know where the prostate was. So prostate gland is present right underneath the bladder. If you look at the side view of this human animation, you can see there is a bladder here, which is connected to the ureters. And then right underneath the bladder, we see this prostate gland. Right below there's this penile penis, and then testicles. So this is located right underneath the bladder. The next thing is, what is it? What is prostate gland? Now, first important obvious information is prostate gland is present only in men. Women don't have prostate gland. Now, it's a gland. So a gland is a organ in the body which supposedly secretes secretions. So its main job is to produce secretions. And as you know, it forms a vital component of some semen. Now, semen in general is made up of three different components, sperms, which are produced by testicles, um, prostatic secretions, which are produced obviously by the prostate, and then seminal vesicles have their own secretions. So they all three mix together and eventually form semen. So this is the main goal of the prostate gland, to produce secretions which add to the semen, which help maintain the vitality and rigor of the sperms. Now, once we know about what it is and where it is, what is the size of the prostate gland? I know we're not asking any voting, but just assume these three sizes. If you look at the size of an orange, size of a walnut, or a grape, what would the folks think? I know we don't have open voting, but if you may have thought about the answer, it's actually size of a walnut, roughly about 4 centimeters in size in the maximum dimension. And it is present right underneath the bladder. Okay, so we know what is prostate gland. We know about where it is, what is the size. So what can go wrong with it? Now, the most common problem with aging is an enlarged prostate, and we call it as benign prostatic hypertrophy in medical terms, but which commonly means an enlarged prostate. Now, this is it's a very common problem in prostate, and it is seen primarily in men above 50. Now, very important point to remember is an enlarged prostate because of benign prostatic hypertrophy or hyperplasia doesn't mean it is cancer and does not increase the risk of cancer. So it's very important to know that it is, for whatever reason, the prostate has increased in size. And as you can see, this is the normal bladder, which comes out where, through the prostate through a duct called urethra. And normally it's nice and wide open, but whenever there is enlargement of the prostate due to that hypertrophy, it can result to narrowing of this passage and result in symptoms. Stepping next to other kind of problems, the other common problem in prostate is something called prostatitis. It is, inflammation. It is some sort of infection, and it is generally seen in younger men between 30 to 50. It generally causes pain, discomfort, fever, kind of symptoms. It's not common. It's generally rare. And again, it is not prostate cancer, and it does not increase the risk of prostate cancer. Now, obviously, the third important thing which we are focusing now is what can go wrong from cancer perspective. So there could be development of cancer in the prostate, where the normal prostate cancer cells, for whatever reason, turn into cancer cells. And the unfortunate situation with prostate cancer, or any cancer in general, is the cells grow in an uncontrolled way, which leads to growth of this mass and then subsequent symptoms. Now, what are the symptoms? Whenever the prostate has a problem, either as an enlarged prostate or due to cancer or really from inflammation. Now, what are the symptoms? What do people notice? Sometimes people notice nothing. People can be completely asymptomatic when it is in early stage or when it is not causing any serious obstruction to that ureter. But otherwise, the common symptoms we see as needing to pee more often, either in the daytime or at night time, waking up multiple times in the night. That could be a common issue with the prostate. And the other thing which I showed you in the prior slides, the drainage tract, the ureter, can get compressed, and this may cause it difficult for someone to pee. And because of that narrow passage, the flow can be very weak. Sometimes there will be just dribbling of urine. And then the other thing to also remember is it can also give you a sense of urgency to pee, so that you have a strong urge and you need to pee right away. So the urgency to go to pee. And then despite having hitting the restroom, people may feel they have not emptied their bladder completely. And as I said, it can also cause dribbling. So waking up multiple times at night, having the urge, narrow stream, dribbling, and sense of incomplete emptying of the bladder. Now, this is one important aspect. Though these kind of situations can happen with both prostate enlargement due to hypertrophy or due to cancer, the symptoms are in general common. So that is very important to pay attention because the symptoms may look same for cancer or hypertrophy, but they both are completely different and they both are managed in completely different ways. So it is very critical for folks to pay attention to these symptoms and seek attention based on how they are. Now, having learned about the situation with cancer, so how common is prostate cancer in United States? Now, these are the numbers from American Cancer Society, and these are the estimated new cases and potential deaths that can arise from prostate cancer. As you can see, for the year 2023 in United States, about 288,000 new cancer cases are predicted to happen, with associated about 34,000 deaths, roughly, about 10 to 10.5%. Now, obviously, if you look at, it's the most common cancer in men. And then the other genitourinary cancers, which I mentioned, bladder is another component of the genitourinary system. It is a sixth most common cancer in the United States with about 82,000 incidents. Now, the third most common cancer that can arise in the genitourinary tract is the kidney and renal pelvis cancer with about 81,000 cancer instances. So as you can see, cancers arising from the genitourinary tract are among the top 10 cancers, including prostate, bladder, and kidney. And in men, if you look at the most common cancer, it is prostate with highest incidence. Now, fortunately, still we see a lot of deaths, but compared to other aggressive cancers, for example, lung, fortunately, the mortality is less. Now, this pie chart also shows us, how much this cancer represents. So among all the cancers that are diagnosed in a year, prostate cancer represents about 14% of those. Now, who is at risk of prostate cancer? What is the incidence and who is at risk? Again, there's another schema to show all men are at risk. And then about 13 out of every 100 American men will get prostate cancer during their lifetime. So that's the risk. And the next is the risk of dying. So being diagnosed, the risk is 13. And the risk of dying from prostate cancer is about 2 to 3 men out of 100. Now, who gets prostate cancer? So it is a cancer of old age, most common in older folks compared to young folks. It's extremely rare to see someone in their teenage or in middle age to see cancer in the prostate. Now, this is another chart which I like to show where, what is a common age group of incidence. The mean age of diagnosis is 67. But as you can see, this bar charts, the most common age group, about 41% of men in the age group of 65 to 74 are diagnosed with prostate cancer. And then we also see about 31% in the 55 to 64 age group. And then in older than age group 84, it is about 3.9%. Now, one thing to remember is these are though the percentages here are less, the prevalence, like, unknown diagnosis of prostate cancer may be high in this age group, but we avoid testing in this age group to prevent any early stage cancer diagnosis, which may not have impact on any of the outcomes. Next one. So apart from aging men, the risk of cancer is also high in folks who have family history of prostate cancer, and specifically men of African American descent. Now, it is also important to see that the men are at risk of about 2.5 times higher risk if they have a father or a brother who has diagnosed with prostate cancer. This is compared to the men who do not have any family history of prostate cancer. So aging men, African American descent, and folks with family history of cancer. Now, it is very important that, so we identified that prostate cancer is in general common. And the other thing we have identified that is it is at high risk for men at 50 or more, and African American descent or family history. So the key point to take away from this talk is early detection saves lives. Now, and I'll dive into a few points here now, but if we identify prostate cancer at an early stage, when it is restricted to prostate area, then we can address it in an easy way with several treatment strategies, and then, protect it from becoming life-threatening. So it's very important to learn that early detection of prostate cancer actually saves lives. Now, based on that, so how do we detect early? So detecting early means screening, in the sense identifying the prostate cancer before even it causes symptoms. When I spoke about symptoms earlier, I have shared the information about different kinds of things that can it present with, urinary frequency, waking up at night, dribbling, and narrow stream. Obviously, when folks have those symptoms, should right away seek medical attention. But other thing is, if you don't have those symptoms, what could you do to identify the risk of cancer? Is early staging or early screening. So according to the American Cancer Society, men at age 50 who are at average risk of prostate cancer should undergo prostate cancer screening. So it is anyone at age 50 without any major health issues. Whereas men at age 45 who are at high risk of developing cancer should start getting screened for prostate cancer. And who are they? They are the men from African American descent and also a family history of prostate cancer. And the other recommendation is men at age 40 who are at very high risk of developing cancer. That is, who have young family members diagnosed with prostate cancer, breast cancer, ovarian cancer. Now, there is a rare syndrome, not common, very rare. It's called BRCA2 gene mutation, BRCA1 gene mutation, which can run in the families, and that can predispose men to develop prostate cancer. So if there is a strong family history where several members of the family have cancer, then at age 40, they should consider getting screened. It is important to identify those risk factors so that they can get screened at an appropriate time. Now, okay, how do we do the screening? So we spoke about the risk of cancer, at what age groups the different risk stratified men should undergo screening. The most common modality is using a blood test called PSA. Now, it's a blood test that specifically measures the amount of prostate-specific antigen in the blood. Now, a key factor to remember is an elevated PSA doesn't by default mean patients have cancer. It could be from other problems other than cancer. I previously spoke about inflammation of prostate called prostatitis and enlargement of prostate called BPH. They also are known to cause elevation of PSA. Now, the other point to remember is a very low PSA, less than 1, is considered normal. And in that situations, the risk of cancer is negligible. If patients have no symptoms, no issues with prostate-related symptoms, and the PSA is very low, like for example, less than 1, is considered to be unrelated to cancer. Now, what is the normal value of PSA? When you go to the blood draw, we have this number. Now, the range of PSA can sometimes vary from lab to lab, what they call it as normal range. The general accepted number for a PSA to be normal range in the absence of any kind of symptoms is less than 4. But again, urologists, primary care doctors, and we as cancer doctors gauge different features to decide what is a normal range, what is an abnormal range. So there's no specific number per se, but generally a number less than 4 is considered a good number. Now, what are the other methods of screening? A digital rectal exam, this is done in the clinic where a finger is placed in the rectum to feel for the prostate in the front. It gives an idea if there is any abnormality in the prostate. The doctors look for any enlargement of the prostate, any hard bump in the prostate, and that can help us identify the cancer through an exam. But eventually, if based on the screening, if there is elevated PSA with a nodule or abnormal concerns with symptoms, eventually we consider obtaining a biopsy to confirm the cancer if there is any. Now, the other important aspect, as I was just saying, okay, so as early screening saves lives. Why? How does it imply? So if we went through an asymptomatic patient who has significantly elevated PSA, eventually underwent a biopsy and it confirms cancer, and we have different types of options to take care of it. We can consider surgery, or we can consider radiation therapy, plus or minus some sort of treatments called hormone therapy. Now, very, very important to know that it's not just one treatment for prostate cancer. There's a combination or a different varieties of treatments. So it is a patient-specific approach based on the stage of the cancer, based on the risk of the cancer, because it's not just one cancer called prostate cancer. We again divide the patients based on whether it's a low risk, which is an intermediate risk, or high risk. Has it spread to the lymph nodes? Has it spread to outside of the lymph nodes? So we look at various aspects. And other important point to know is not all prostate cancers need treatment. Yes, for patients who have a very low risk prostate cancer that is restricted to prostate, we definitely have the option of something called active surveillance, where we avoid doing surgery, avoid doing radiation, and we watch the patients carefully, because the risk of it growing and spreading are very minimal over the course of years. So we avoid doing any of those measures. So it's very important to know that it's not just one thing that is done for the prostate. There is a spectrum of things that could be done based on individual patient needs. So it is more an individualized therapy based on the clinical situation. Now, as I said, each scenario is different, but when we consider all patients diagnosed with prostate cancer, the probability of surviving for 5 years or more is 97. So it is critical. So which tells us that, if we identify cancer, it doesn't mean it's a serious situation, because we have several treatment strategies which can take care of the cancer and prevent it from becoming life-threatening. So it's very critical to know that the 5-year survival after cancer diagnosis in general is very good for about, with a 97% survival. Now, so we learned about what is prostate cancer, what are the symptoms, who are at risk, how do we screen, what are the treatment options, and what is the survival. Now, obviously, the other big question is, okay, what can we do to prevent the cancer? Is there anything that can be done to prevent cancer? Now, I'll spend a few minutes here. Now, obviously, there are a few things which we can do to change the risk, but at the same time, there are a few things we cannot change. They're not under our control. Now, as you can see, we cannot change aging process. We cannot change the genes which we are born with. We cannot change, our head, the race aspects of it. Because as I said, with change, as men age, as a sign of aging, the cells kind of change their maturation process, because of that, eventually it leads to cancer. Now, if you are born with some kind of genes, which I spoke about, BRCA2, BRCA1, which are inherently known to predispose to cancer. Now, these genes are called tumor suppressor genes, which protect the body from cancer. But if there are mutations in those genes, when they are abnormal, then it leads to cancer. Now, but it is important to know that there are a lot of things you can do, very proactive to reduce the chances of cancer and have the best, life aspects, quality of life. Now, obviously, with evidence, it has been shown that by reducing fat content in the diet, the risk of prostate cancer can be lowered. Again, these are more like population-based studies. These are not based on a randomized controls trial where men who went through fat-based diet and not fat-based diet then compared, but it is based on a big overview of population studies where different kind of questionnaires were sent, and it is based on those factors we identified that these are the factors which lower the risk of prostate cancer incidence. So reducing fat intake. And then recently, it has been shown that people who follow more of a vegetarian diet, diet which is rich in fruits and vegetables and very low on meat, especially red meat, have a lower risk or incidence of prostate cancer. Now, obviously, maintaining a healthy body weight is also important because overweight, in addition to other aspects, is also a predisposing factor for development of prostate cancer. So exercising regularly is very important. This not only helps you maintain in shape, but also helps reduce the risk of cancer and helps in keeping your weight in check. Now, smoking cessation or non-smokers are always at an advantage in a way because it reduces the risk of cancer. Again, with regards to alcohol consumption that comes up, again, alcohol consumption has been studied as a component to evaluate for risk factors for various cancers. But one important thing to note is, obviously heavy drinking is not good, but we generally recommend, social drinking or limited drinking per week has, a potential to lower the risk of the cancers. Now, other important aspect with regards to prostate specifically is staying sexually active. I know it's important because, it helps with the maintenance of normal, the genitourinary access, by maintaining active sexual life. Regular ejaculation will help remove some of the toxins. So that way we can also reduce the risk of prostate cancer. Now, I'm not mentioning few things in the slides, but the other important thing is, are there any supplements? Can I take any supplements so that I can maintain my prostate health and reduce the risk of cancer? Now, there have been studies, about specifically something called selenium. There is another multivitamin, especially vitamin E. Both of those agents have been studied in big studies and have not shown to reduce the incidence of prostate cancer. In fact, for example, folks who took high amount of selenium in order to prevent prostate cancer actually they developed a higher chance of developing a high-risk prostate cancer. It reduced lower-risk prostate cancer, but a high-risk prostate cancer incidence was higher. So currently, there are no supplements that are being recommended to be used on a routine basis to reduce the risk of prostate cancer. Now, the other important aspect that comes up is, what about testosterone supplements? Currently we have, especially in the last decade or so, testosterone supplement has been proven to be helpful for the men who have low testosterone related symptoms, decreased libido, weight loss, fatigue, weakness, poor well-being, and known to have low testosterone levels on evaluation. With replacement of testosterone, their overall health has improved. It doesn't not increase the risk of prostate cancer, but the important thing is testosterone supplement has to be in very specific indication group, not in general, even with normal testosterone levels. So it's very important to make sure that it's being replaced in men who have low testosterone levels. So having said that, let me get to my conclusion, and I'll open up for the forum to have discussion and questions for the group. So in men, prostate is one of the most common cancers. And the big thing to take home is it can be easily detected by screening, by checking PSA levels or based on rectal exam, and can be identified at an early stage. There are several treatment strategies for prostate cancer, and people have excellent survival after cancer diagnosis. So it is very important. So obviously the take home point is also, is to not ignore any of the prostate related symptoms. And if there is a high risk in the family of developing any kind of cancers, it's important to talk to your doctors, primary care doctors, to make sure you pursue or have a discussion about prostate cancer screening, to identify, is it something beneficial, or what are the risks and what are the harms. It's important to discuss with your primary care doctor about your specific situation and get the screening. At Baptist Health, at Miami Cancer Institute, we are a specialized team. We work with our primary care doctors, we work with our urologists. We all work as a team as to come up with the best strategies to help men in the community, to help with early screening and appropriate diagnosis. And in the worst case, there is a cancer diagnosis, to come up with the best treatment strategies so that the cancer is addressed in a best way without any serious side effects, so that men can live their life without any serious implications from that. With that, I would like to thank you everyone for your time and patience in following through my slides, and feel free to ask me any questions or reach out to me with this email. I'll open up the